great. Thank you so much. And thank you everyone for making the time. Because I know that, now even in a virtual world, there's a lot of competing efforts. So I know everyone is very dedicated to this effort for, the International Atomic Energy Agency and the Islamic Development Bank. So I'd like to welcome His Excellency, which I know is here, before we do a short presentation of the video. At this time, I see that some of the speakers do not have their videos on. So if all of the speakers could please turn on their videos. Thank you. And testament to a rich discussion. We have a lot of panelists and a lot of attendees. So with no further ado, if we could click the video.
The fight against women's cancers has received a major boost that could help save over 5 million lives. Breast and cervical cancers are largely preventable or treatable in richer countries, but are often a death sentence in the rest of the world. Most of these deaths could be avoided if modern prevention measures, cancer screening and treatment were in place. The Islamic Development Bank has joined forces with the International Atomic Energy Agency to mobilize the funding and expertise needed to tackle this issue. Saving Women's Lives from Cancer, a global initiative for breast and cervical cancer control, will bring the international community together to deliver tangible results so that more women will have access to treatment. Between 70 and 90% of breast and cervical cancer patients require radiotherapy, but it is often hard to access. The projects funded by the new initiative will expand breast and cervical cancer control programs, including the upgrade of cancer facilities and the training of cancer care professionals. The bank has committed an initial $10 million US in grant funding, and the partners are now seeking other technical experts and donors to contribute to this important initiative.
Millions of women around the world, but in particular in developing countries, are dying because of cancers that are perfectly treatable and curable in many other places. We have the technologies, we have the science to do that, and we have the resources. It's time to put this together and put an end to this tragedy.
The partnership between the Islamic Development Bank and the International Atomic Energy Agency will widely address cancer prevention, screening, diagnostic and treatment of women in our common member countries. This partnership will contribute to saving the lives of up to 5 million women from breast and cervical cancer over the next decades.
Help us to save lives and join the global effort in fighting women's cancer.
Thank you so much, and thank you so much to His Excellency for being here. The Islamic Development Bank, as the video said, has been a true champion in this effort, which has received a lot of international recognition. So His Excellency, over to you.
Distinguished guests, ladies and gentlemen, very good morning and afternoon. Assalamu alaikum wa rahmatullahi wa barakatuh. It is a great honor and privilege to speak to you today by video conference from Jeddah, Saudi Arabia, about our fundamental partnership with the International Atomic Energy Agency, which is centered around saving women's lives from breast and cervical cancer. Let me begin by giving you a brief overview about Islamic Development Bank. We are a multilateral development bank working to improve people's lives by promoting social and economic development in 57 member countries across 4 continents and Muslim communities worldwide. The Islamic Development Bank is one of the world's most active MDBs with a subscribed capital of $70 billion as a global leader in Islamic finance with AAA ratings. Our operating assets stand at more than $16 billion. We believe all people have the right to live in dignity and prosperity, and that nurturing economic growth is the best route out of poverty. We equip people to drive their own economic and social progress at scale, putting the infrastructure in place to enable them to fulfill their potential. We built collaborative partnerships between communities and nations across the public and private sector. We foster innovative and sustainable solutions to address the world's most pressing development challenges. As we work towards the United Nations Sustainable Development Goals. Distinguished guests, ladies and gentlemen, as the global cancer burden continues to increase, international organizations, including multilateral development banks, are united in their desire to work together to address this major challenge. Developing a new partnership and strengthening the existing ones is a key priority for the Islamic Development Bank. I am very proud of this flagship partnership initiative, which will contribute to saving over 1 million women's lives from breast cancer and 3.7 million women's lives from cervical cancer over the next decade. The IAEA and ISDP have a long-standing collaboration to support member states of both institutions to improve cancer control. Since 2013, the ISDP has approved $364 million in grants and loans for cancer control programs in such countries, but there is still much work to be done. Distinguished guests, addressing women's cancer is a matter of priority, and scaling up effective diagnosis and treatment has become a pressing issue, especially amid of COVID-19 pandemic. Significant investment involving a broad range of partners in a comprehensive cancer control are crucial to improving the quality of life for women affected by cancer, and at the same time strengthening national health system. We look forward to working with other partners to contribute to the global efforts to save millions of women's lives from breast and cervical cancer by giving them a fair chance through increased access to prevention, diagnosis, and treatment. Through our collective efforts, we will also provide a tangible contribution towards the United Nations Sustainable Development Goal 3, 5, 9, and 17 by working with other partners to improve gender equality and basic human rights and access to health services, as well as encouraging innovation, boosting research and development spending. On behalf of the Islamic Development Bank, I would like to thank you all for attending this virtual meeting. Special thanks also go to our special partner, IAEA, for their valuable efforts to make a success of this initiative. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Your Excellency, and thank you for your vision in terms of the 5 Ps. The vision of the public-private partnerships has been really inspirational. And so I'd like to cue up the video of the Director General for the International Atomic Energy Agency. He's unable to join us because of geopolitical issues.
Let me begin by expressing my gratitude and appreciation to Dr. Bandar for his visionary leadership on the issue of women's cancer. I commend the Islamic Development Bank for jointly championing this initiative with us and generously committing essential resources to help save women's lives. Tackling cancer in developing countries is a top priority for the IAEA. This initiative is an ambitious step forward in addressing the inequalities surrounding women's cancers. Breast and cervical cancer are treatable and often curable in industrialized nations. However, in developing countries, both are leading causes of death among women. The fact that 80% of Africans have no access to radiotherapy, which plays a vital role in treatment of breast and cervical cancer, is a scandal. It is simply unacceptable. We must do everything we can to change this. As a gender champion, I am committed to helping to ensure that every woman has a fair chance against cancer, especially the most vulnerable women who live in developing countries. The COVID-19 pandemic has shown that cancer patients are at risk of being left behind. We need to ensure that this does not happen. For many years, the IAEA has assisted developing countries in improving access to radiotherapy and nuclear medicine, thanks to the long-standing and generous support of many of our member states. The IAEA and the Islamic Development Bank have invested significant resources and expertise in the area of cancer, but this is still not enough. More funding is urgently needed. The Saving Women's Lives from Cancer initiative, which Dr. Bandar outlined, will also help support the new World Health Organization global strategy for the elimination of cervical cancer. WHO strategy calls for 90% of women diagnosed with cervical cancer to have access to quality treatment and care, including radiotherapy, by 2030. This is an ambitious target, but I believe it is achievable if all parties, including those of you taking part in this roundtable today, play our part. We are very grateful for our long-standing relationships with existing partners. We need to further strengthen our collaboration with the private sector, foundations, multilateral institutions, including valued partners as the Asian Development Bank, which I'm pleased to welcome today. Together, we can demonstrate that smart investments will have long-lasting results for millions of women and girls. The beneficial effects on them, their families, their societies, and their countries' economies will be simply immeasurable. It's up to us. Let's make it happen. Thank you.
Thank you so much. And I know, thank you for the International Atomic Energy Agency's commitment. I know we have Deputy Director General Mokhtar here with us. I'd like to turn it over to Dr. Hayat, the true leader, not only in, with the Women's Cancer Initiative, but also in a lot of the innovation partnerships that she's done throughout the past few years, really promoting women to the next level, and especially now in this Women's Cancer Initiative. Dr. Hayat.
Thank you, Joanne. بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين. Assalamu alaikum, welcome everyone, and thank you for joining us today as we discuss the development of the exciting new program that ISDB and IEA has partnered together for financing, for expansion, and for access of cancer services in low and middle income countries. Next, please. The health sector is a priority for ISDB, and we do really value our partnership with IAEA. Our program, as you heard, is called Saving Women's Lives from Cancer, and is designed to aid the development of national cervical and breast programs. And according to the IAEA, worldwide, more than 8.6 million women suffer or could die from relatively curable and preventable cancer. And this is, as you hear, is worsened and is more pronounced in the low and middle income countries. And you hear that from His Excellency and DG, this is not fair, this is not acceptable, especially knowing the low cost of treatment. Treatment could save lives. So ISDB has been for a long time committed to the global fight against cancer. And now more than ever, with the background of COVID-19, we must not forget issues like women cancer. And especially now we are coming to the 5th anniversary for UN Sustainable Development Goals, which ISDB really has aligned all its work to contribute to the Sustainable Development Goals under the leadership of His Excellency Dr. Bandar Hajjar. Next, please. As you heard from His Excellency, since 2013, ISDB has approved more than $364 million in grant and loans for a control cancer program in IAEA member state like Uzbekistan, Niger, Guinea, Suriname, and Djibouti. And of course, we do need to do more. And we need to do more because of the statistic you have showing there here in the presentation. As you can see here, a woman has a less chance who live in a developing world than a woman who live in developed world. For example, if you compare Jordan with USA, 43% compared with 86, that's a huge gap. And also if you look at the 5-year survival rate, 14% of women who live in Mali compared with 86% of women who live in Australia. It's a huge, huge gap. And also if you look at the statistic for cervical cancer, 80% of the all new cases of cervical cancer actually occur in the developing world, which actually are part of our member country, Muslim country. And also, if you can look here, women who live in a low-income country has 6 times the chance to die than a woman who live in high-income country. And the same thing for the 5-year survival rate. You can see women who live in Tunisia compared with women who live in Korea. So this partnership really wanted to change the statistic. Every single woman has the right, poor or rich, for diagnostic, for treatment, and for monitoring. Next, please. And that's why by this initiative, hopefully we're going to save the life of 5 million women combined by cervical and breast cancer. But for this partnership to be effective, we need to be creative for source mobilization because we do need the whole stakeholder to be part with us. And we need to be innovative of finding solutions for our challenges. Next, please. And here are 3 key pillars of a partnership for donors like you who wanted to be involved. First, we need to really increase the coverage of for screening and early detection. As you know, the early detection is act as the front line, can change completely the life of any person from life and death. And also we need to increase the capacity for health facilities and also for treatment and for training for health take care, because they can reach a rural area, they can reach cities, because everybody needs to be involved and everybody needs to be has the right and equal right for accessibility for healthcare and well-being. And also we need to ensure through all this partnership the quality practice, because we need to make sure the women who are getting our help, they are getting the best, because they deserve the best. Next one, please. And as I said before, for ISDB, creating or having a new partner is a key strategic pillar. And we do value very much a partnership like this. And it's about time to encourage the Muslim world to talk about women health. It's about time to remove the social stigma around it. And through this initiative, we have 5P, the blended finance instrument, which is involved 5 Ps, which is coined by His Excellency. And 5 Ps refer to partnership between public sector, private sector, philanthropic organization, and people, civil society. So there are many variety of opportunity to partner this program, and we look forward to discussing this with you further. I hear a stop, and I thank you very much. And now we hand over to my best colleague from IAEA, Dr. Lisa Stevens, who is the director of PAC program at the IAEA. So she can tell you more. Thank you very much.
So let me first welcome DDG Mokhtar, who's joining us from the IAEA on behalf of the Director General, who does send his regrets. And I'm just delighted to have this opportunity to highlight the important role that IAEA plays as a technical partner in this initiative. Next slide. So the IAEA is part of the UN family, and we're a science and technology-based organization with specific technical expertise in cancer diagnosis and treatment. Next slide. And we have a unique mandate at IAEA to support our member states to peacefully, safely, and securely use nuclear technologies. And under the partnership that we're talking about today, this is in the arena of human health. IAEA supports the building of capacity and infrastructure for member states to use radiation for cancer diagnostics and treatment. And we specifically focus on the transfer of technology and expertise to member states. Next slide. Cervical cancer, as you heard, is a leading cause of cancer death for women, and in 35 of the 48 countries in sub-Saharan Africa, it's the leading cause of mortality of women of reproductive age. We've heard that globally 570,000 women in 2018 were diagnosed with cervical cancer, and of those, 310,000 women died just in 2018 alone. And 88% of all new cases and 92% of all deaths occurred in low and middle income countries. And of the single treatment modality interventions, if we were able to expand the availability of radiotherapy, this would yield large survival gains in low income countries. And in this slide, we show that 71% of cervical cancer patients and nearly 90% of breast cancer patients are recommended for radiotherapy at one point in the course of their treatment. Next slide. As an agency, we have more than 60 years of experience assisting member states to improve radiation medicine. We have invested our own finances, more than 172 million euros, to support cancer-related projects in our member states. And we currently have around 115 cancer-related projects with our member states. And again, this is to transfer nuclear technologies to address cancer. Next slide. So you've heard that this initiative will help member states to address the SDGs, the no poverty, quality education, gender equality, peace, justice, and strong institutions, as well as partnerships for the goals. And all of this is under the umbrella of SDG 3, good health and well-being. Next slide. You heard our opening speakers talk about the WHO Global Elimination Strategy for cervical cancer, and the WHO member states have recently adopted this strategy to work together to eliminate cervical cancer. And the ambitious goals are outlined here on this slide. And essential to achieving these goals is really bridging the inequality gap between high and lower income countries. The division that I lead works with partners across this entire spectrum that's represented in this slide in cancer control. And with the technical expertise of the agency, this really comes to bear in the third pillar, the 90% access to treatment, because radiotherapy is key to curative treatment of advanced disease. So these are ambitious goals, and we really need everyone to work together in order to meet them. Next slide. So we're looking to expand beyond the generous support of governments and private sector that we've received to date. And when joining this partnership to save women's lives, you will have the opportunity to join other global players, including other UN organizations like UNDP, UNICEF, and the World Health Organization, who are already working together to improve the health and social welfare of women and girls, and to improve access to life-saving treatment for breast and cervical cancers. And with the recent adoption of the WHO Global Strategy, we really can work together to support that 90% access to treatment, specifically in radiotherapy. So together we can make strides to address the most common cancers in women globally, which is breast cancer. Next slide. So we've had many supportive partners over the years, and we have made progress. And together with the ISDB, under the Saving Women's Lives from Cancer initiative, we have the opportunity to do more with your help. So we would like to add your name to the list of supporters and partners. Next slide. So thank you very much for your attention, and I look forward to the discussion.
Thank you so much, Lisa, and thank you, Dr. Hayat and Dr. Stevens, for your remarks. I think, basically in terms of the blended financing partnerships that Dr. Hayat mentioned, those are so crucial for an initiative like this, where there's the combination of the donor capital and also, private sector partners working together. And Dr. Stevens for the public-private partnerships that are so crucial. And I know that the IAEA has been doing an amazing job as bringing some of these public-private partnerships together. I'd like to now turn it over, because I know we are a little bit over time, to some questions from the different experts around the table. And thanks again for all your participation. I'd like to turn it over to His Excellency Ambassador David Hall from the UK, and ask you a question in terms of the United Kingdom has been an important supporter of the IAEA over the past decades, and is also known for pioneering innovative financing approaches. How can this be leveraged to further advance cancer care for women in low to middle income countries?
Good afternoon from Vienna. Good morning to those of you who are on the East Coast of the United States. And wherever you are, I wish you a warm greeting. And I'm very pleased to be part of this very important discussion. As you know, Joanne, the United Kingdom is a strong historic supporter of both the IAEA and specifically the PACT programme, and we recognise all that the IAEA does to improving the lives of people around the world, whether that's to do with improving people's security through countering proliferation or assisting member states with specific development goals. And that's why the UK is a big contributor to the agency's work. We pay our technical cooperation fund, that's not far short of £4 million a year, and we also provide significant extra budgetary support, around about €5 million of work, developmentally focused agency work since 2016. On global health, that is also something the UK government is particularly interested in, and we are a very large donor, probably in the second or third donor in globally on this. We spend around about $2.4 billion on health-related ODA in a year. So this is a big issue for us. And one important thing that's happened for the United Kingdom is that on the 2nd of September, the United Kingdom launched a Foreign, Commonwealth and Development Office, which is essentially a merger, a full merger of our Development Ministry and our Foreign Affairs Ministry. The creation of this new department, I hope, will allow us to even more effectively bring together our development and diplomatic objectives. And we also look to the City of London and other private sector firms and research and development organisations in related health issues, and particularly in the cancer work, to play a role here. So I think on PACT and all that we've discussed today, I think there are three ways in which the agency can help move forward, and some of these have already been covered. One is I would encourage the agency to explore how they can increase partnerships and links with non-traditional donors and finance experts. I think I welcome this particular initiative with the Islamic Development Bank, but also some of the issues that Dr. Stevens has also arranged and spoken about. I think from a UK perspective, and work I've done here with Lloyd's Foundation in London is an example of where such links can be helpful, and I would encourage the agency to continue to look at city and financial institutions. Secondly, I would look at specific expertise in the UK on treating women's cancer. I think we have a lot, and I think if we can leverage this expertise by strengthening links between the IEA and private sector, that's pharmaceuticals, but also universities, research and development organisations and cancer foundations, this can help reinforce the PACT programme and better assist member states to make sure they're up to date with the most advanced and efficient cancer care. And finally, and perhaps most importantly, is the need for the agency to continue to build the brand, if you like, the IEA Global Health Development Pact brand, so that we can boost partnerships and support resource mobilization efforts. I think the IEA is too often only looked at as the nuclear watchdog, and I think we need to do more to promote the agency's development work, including health and specifically cancer work. And I encourage the PAC team and the agency more broadly to continue its good efforts to raise awareness and to use innovative financing models like that with the Islamic Development Bank as an example of why the agency is a place that is worth doing business with. To finish, I think combating cancer remains a top priority for the United Kingdom government, and so I can assure you that the UK mission here and colleagues in London are working and will continue to work with PACT to see how we can leverage the opportunities described just now to ensure that the IEA is able to help low and middle income countries get the best possible cancer care, which is an objective we all share. So congratulations again for the initiative with the Islamic Development Bank, and it's a pleasure to be part of this. Thank you.
Thank you so much, Ambassador. And thank you again for the work on innovative financing. I know a lot of the governments have now been doing different blended financing mechanisms, and the one that, you know, both the ISDB and IAEA have been developing has garnered a lot of international attention. I'd like to turn it over to the Deputy Director General of IAEA, Deputy Director General. You know, as the Director General of the IAEA said, we must do everything to give women a chance against cancer, especially in developing countries. As no institution can do this alone, what do you think is the role of your organizations and others to bring more partners into this initiative, in particular non-traditional partners, which we've seen are difficult to sometimes socialize?
Well, thank you, Joanne, for these questions. I think, as DG has mentioned in his speech, the tackling cancer program is one of the important programs at the agency, and we are helping since many years. Thank you. So building partnership with the private sector and with other non-traditional donors is very important for the IEM, and we heard Ambassador Hall saying that, you know, the agency is known more about its watchdog role, but not in the development area. And as you know, we have a lot of activities on cancer and non-communicable disease-related issues, but we need to do more, and we need your help to reach out and talk about our activities. So partnering with the private sector and with non-traditional donors is key for us, is priority. DG has mentioned, and this initiative, Saving Women's Lives, is really a leading model, an example of this new way of doing business and bringing more partners, also from the private sector. And we have heard also from Dr. Hayat, in just 1 year since we launched this initiative, jointly with the leadership of the Islamic Development Bank, new organizations have come on board and bring in expertise, knowledge, as well and new investment. And this meeting today actually is an excellent testimony on how we are all aligned, member states, governments, private sector, foundations, and financial institutions, and UN organizations around this noble cause, an important cause actually. And as you know, the IEA, Lisa has mentioned that too, is a technical science and technology-based organization. We have technical expertise in cancer diagnosis and treatment, and we offer assistance and expertise to all our member states to support them in the fight against this disease. So we provide technical expertise and drive innovation and technology with projects that can be scalable and result-oriented. The IEA committed to ensuring that women's cancer are kept high on the global agenda. And as a woman from a developing country, this initiative is really dear, close to my heart, and gives me the hope that we together, we will reach the goal to give the right to each and every woman around the world to have access to treatment on time. And I look forward to more partners joining us in this endeavor today, in the coming month. And I wish you a successful meeting and deliberations, and I apologize because I have to leave for another meeting. Thank you very much.
Thank you so much, Deputy Director General. It's been actually an honor to work with such inspiring women. And I don't say that just because I'm a woman myself, but the leadership, you know, of Dr. Hayat, Dr. Stevens, and yourself has been amazing. So this will truly be, I think, one of the best international global partnerships.
Thank you very much.
Thank you. I'd like to turn it over to the chairman of the board of directors of the Friends of Cancer Patient. You know, His Excellency Swanson, the Friends of Cancer Patient is a leading organization in the cancer arena and serving as cancer patients all in the UAE and beyond. How do you think this initiative can benefit your organization's expertise and your personal engagement to ensure that more women and adolescent girls with cancer can access this life-saving diagnosis and also treatments?
Thank you, Joanne. Assalamu alaikum wa rahmatullahi wa barakatuh. This is a highly apt and very important question. Essentially, how do we disseminate our messages to the widest possible audience for benefit to the community that we have been established to serve? This is no doubt a matter that we are all continually facing in our work, and I will be happy to briefly share FOCP's experience in that regard in the short time available. First of all, thank you for inviting me to participate in this highly important discussion. And I would like to thank the International Atomic Energy Agency and the Islamic Development Bank for partnership in this greatly needed and very important initiative of saving women's lives from cancer. For those not familiar with FOCP, a very brief introduction. Friends of Cancer Patients was founded by Her Highness Sheikha Jawahir bin Muhammad Al Qasimi, wife of the ruler of Sharjah, 21 years ago. It was founded primarily to serve cancer patients by providing treatment and moral support to cancer patients and their families, to promote awareness, health education, early detection and screening, and advocacy on both national and international level to improve cancer-related policies and universal health coverage. In answer to your specific question, we have found it effective in disseminating our messaging by working with multi-sectoral funding partners, with banks, private sector, government sector, other NGOs, to engage effectively with their wide audiences due to credibility that FOCP has established over the years owing to transparent reporting and inviting participation in our various public events and activities, often tailored also to match CSR needs of such partners. Donors seek impact and sustainability, and this is what we try to ensure. Secondly, by engaging with the media and effective use of the social media at all levels, and every opportunity to ensure targeted messaging to women and adolescent girls, including at schools and universities. A pertinent success story worth mentioning today is, in this context, is our advocacy through the highly successful Pink Caravan campaign launched by FOCP 10 years ago. It's a mobile clinic that travels around the UAE, including to remote areas with horses, riders, and great interest from the media to ensure that women have access to screening and to enforce health education and health literacy, and empowering women to really take charge of their own health. Thank you.
Thank you so much. Thanks again for your comments. I'd like to turn it over to the Assistant Deputy Administrator, Monique from USAID. USAID has done a lot of the different innovative partnerships that have been discussed to date in terms of innovative financing, a lot of creative public-private partnerships with not only pharmaceuticals, diagnostic companies, and especially more than ever under COVID-19. So Monique, what role do you see developing agencies playing in catalyzing both governmental and private sector support for women's health? And how can we look across sectors to empower women in both education, entrepreneurship, as well as health to address the rise in women's cancers in general and cervical cancer in particular?
Great, thank you very much. Joanne, I appreciate the opportunity to be here and just want to give greetings to excellencies, colleagues. I think USAID's position is that development agencies can play a unique role in catalyzing support for women's health for several reasons. First, development agencies are seen as being able to set policy agendas and promote the importance of overlooked and neglected and underfunded needs, especially in the developing world. We see this, for example, with neglected tropical diseases, which were just that, and yet because of high-profile advances in treatment, they began to be prioritized. Second, development agencies are often able to make investments in women's health, focusing on diseases which have been neglected or not seen as important, or which donors have been reluctant to invest in. Agencies have the ability to do this and perhaps even provide some seed or incentive funding, which then allow other donors to come in and then begin to engage the private sector and employ innovative financing mechanisms. And then just to bring the private sector in, USAID views the private sector as being critically important to development. If you look at the size, for example, and I know everyone is well aware of this, of the development sector, it's measurable in billions of dollars. But if you look at the size of the private sector, it's measurable in trillions of dollars. And so through private sector engagement, development agencies can facilitate innovative financing mechanisms, including blended finance, rotating trust funds, and other types of really exciting new ways to finance healthcare and health system strengthening. I think one of the ways that we can look across sectors to empower women and increase entrepreneurship is to consider how development activities can support investments in health education and small business. A lot of times this is an indirect effect, maybe direct. Of course, my portfolio is global health, but I do think that even within the global health space, there are many opportunities to support those investments. For the health sector, health system strengthening can increase access to utilization of cancer screening, diagnosis, and treatment. And this is extremely important because as we are building systems to be able to address problems like cervical and breast cancer, we do want to also understand the factors that hinder utilization of cancer screening. And this includes, and I think one of my colleagues mentioned this earlier, empowering women, couples, families, and communities to take ownership of their own health. Ways in which this can happen are by increasing health literacy, decreasing stigma, shame, and fear. I think we're all aware that cancer is a dreaded diagnosis. It's highly stigmatized. Women who are diagnosed with cancer, even in the United States, are often shunned. There are still folk beliefs that cancer is contagious. And so addressing the stigma and the shame, I think, is extremely important. And then also, I would add to that, strengthening civil society to increase advocacy. You know, a lot of the momentum in the United States, Western Europe, and elsewhere has towards addressing cancer has happened through strengthening civil society, because civil society can then begin to pursue advocacy strategies. For example, like the American Cancer Society is an excellent example. It really began as a civil society advocacy group and then really has evolved into having a really huge role in promoting awareness and encouraging people to understand signs and symptoms of cancer, how to seek treatment, and so on and so forth. I think for education, this is my last point, helping to ensure the education of women is a powerful positive factor. For example, for maternal mortality, we know that one of the most powerful positive predictive factors is education. Even moving, not necessarily including improving women's health as far as their awareness of cancer risk and treatment. But I do want to add also that health education should include men and boys so that they can encourage their mothers, sisters, grandmothers, and aunts to care for themselves and seek care as well. And of course, there's the role of health education in schools. And finally, for small business, this is actually my last point here. Promoting and supporting entrepreneurship can increase income, which in turn gives women and families the resources needed to access care. And health system strengthening has follow-on effects which benefit the local economy, for example, pharmacies, home health care, and so on. So I do think that the development agencies can play an important role in that this has ripple effects as well as opens opportunities for what we see as really essential private sector engagement and innovative financing. Thank you.
Thank you so much, Monique. And I know under your leadership, there has been a lot of announcements for these blended financing mechanisms, particularly the innovative financing mechanism around education, which was really revolutionary for the time, and we were involved in some of that. Thank you so much again. I'd like to turn it over to His Excellency Ambassador and Permanent Representative Belgium. Belgium has a long-standing been a supporter of the agency's terms of strengthening both cancer care in developing countries, including right now where we're facing a lot of issues related to COVID-19. How can this engagement be used further to help countries to better serve cancer patients, particularly women?
Thank you very much, Anna, for your question. Good morning, good afternoon, assalamu alaikum to all of you from Vienna. We have indeed been a long-standing supporter of all efforts aimed at eradicating this awful illness. And it is our view that what we need now more than ever is a strong and coordinated response. There's so much attention going to combating the COVID pandemic that we need to bring together all our energies and all our support for the other causes we've been working on for some time now. This is a challenge for all of us. It's a challenge for countries, for international organizations, for carers, for medical institutions, who are, of course, overstretched with COVID very often, but also for the private sector and for civil society initiatives, as so many of the previous speakers have already pointed out. The leadership shown by the IAEA and the Islamic Development Bank is particularly motivational in bringing all these partners together, and I commend you for this joint initiative. Belgium fully supports it. We support your leadership, and you can count on our continued partnership. But let me be more specific and actually answer your question. As a rule, Belgium favors project-based funding. That has also been the case with the projects on cervical cancer. We've, for instance, supported and are still supporting in Tanzania and Morocco. And I can announce that further funds will be made available in the coming weeks to continue that support. Project-based funding offers, in our view, the best guarantees to reach the most vulnerable. It is also, that is my main message today. We need to do everything in our power to reach the most vulnerable. Our policies and our funding should really focus on that. They should be precise, focused, project-based, wherever possible, and they should reach out first and foremost to the victims, to those in need. We need to help them with prevention. We need to help them with delivery of care and services, with aftercare and accompanying measures, not forgetting the families. So this joint ISDB-IAEA document and initiative mentions all these issues and addresses them. but it is our view that in our concrete policies in the field, we must never forget to focus on reaching the victims themselves with projects wherever we can which benefit them directly as our first priority. Thank you very much for organizing this webinar. Thank you for all your efforts every day to heal and support these women, and every success in the future. Thank you.
Thank you so much for those comments, and very needed, because a lot of the project-based financing really helps some, not only NGOs, but small to medium enterprises take off. And that set example, we have Dr. Safar on the phone, co-founder of Sahha Kahani, and also a Transformer Fund winner of 2018 that was awarded by the Islamic Development Bank. It shows, just in terms of how just a little bit of funding between, the donors, the banks, can really change. Dr. Safar is really a leader in some of the work that she's doing in establishing access to critical care for women in Pakistan. So, Dr. Safar, how do you see women being mobilized both to deliver and receive critical care, and what multi-sectoral steps may be taken to ensure sustainability of this effort, like the ones you're seeing discussed in today's roundtable session?
First of all, thank you so much for inviting me and making me a part of this session. I think I'm really excited about being a part of this. So thank you so much, Joanne. And I see Dr. Hayat as well here, and very excited to finally get to meet in person through Zoom. But being a Transform Fund grantee myself, I think it's a pleasure to be a part of this conference. So when you talk about a multi-sectoral approach to access to critical care, I think one of the things that developing countries such as Pakistan essentially lack is the right kind of information and lack of health awareness. So I think it has to be a 360-degree circle where not only entities are making individuals and beneficiaries aware about healthcare issues, particularly when you talk about an illness as critical as cancer. So how do you make a lay person or a common man aware about it? So doing marketing campaigns, activities, direct marketing events, for example, in very low-income communities where those women were not able to access, for example, social media, Twitter, and so on. How can you make community mobilizers, community workers, understand them certain ailments? For example, things as small as self-examination for breast cancer. And ranging from this, taking it all over to not only creating accessibility for cancer treatment in terms of hospitals, digital health, telemedicine, but also making those drugs available to them. And I think the role that donors have to play in this arena becomes very important, because when we're talking about cancer, we're talking about really expensive cancer drugs, which not all of them can afford. And then the role of government in creating access programs. So as a company which is a for-profit entity and which is built on the model of sustainability, I believe that even donors or sponsors need to come in with the support of the respective governments as well, where more patient access programs can be created so that it is supported and funded by not only donors but also by the respective governments to create sustainability. So I believe it's going to be a 360-degree program involving from creating awareness to giving access to doctors and giving access to medicines and then giving access to the payability means as well. So I think this is how I foresee this circle happening.
Thank you so much, and thank you for joining us today. I know that Dr. Safar, we've been working on several projects and also the healthcare access platform for providing critical care to women. Again, we see a lot of the initial funding that came in through ISDB and how that really catalyzed, a leader like yourself. And we look forward to working with you on the primary healthcare access platform in Pakistan with you, MasterCard and Gilead. So thank you again. I'd like to turn it over, in terms of the implementation, the role of foundations is also very important. So, in terms of how we access care, foundations provide a lot of the education and training, as you were saying, Dr. Savar, for that workforce in developing countries. So in terms of, we have the representative from Global Access to Cancer Care Foundation. I'd like to ask a question on how you would see, developing these programs further, and how would you elaborate on some concrete ideas on how your foundation could help with expanding training opportunities as part of this Women's Cancer Initiative?
Absolutely. Thanks for having me today. It's an honor to be here. So one of the things that we've been doing that we're really excited about is we've launched some more immersive technologies into our education programs. We talk a lot about access, but one of the big things we need to do is make sure that we have the physicians needed to actually treat, women. It's one thing to get diagnosed, but the women out there really need confidence in the treatment that they are receiving. So what we've actually done is we have included a virtual program that provides clinicians and physicists a 360-degree view of the training rooms that they're looking at. So when it comes to brachytherapy, not only can they see the tools and procedures that are that they're using, they actually also get to see the ultrasound. So we've created a virtual reality VR library that the clinicians can go back to and say, okay, 8 out of 10 times this can be treated this way. Let's go back and review it again and treat the next patient, differently. So we're pretty excited about the virtual reality component that we're launching. Right now we're starting to launch it in 6 different countries. So we're looking forward to see how we can enhance that.
Thank you. Thank you so much. And in terms of, the National Cancer Institute, I actually used to work at the Susan G. Komen Foundation, leading a lot of their global initiatives. Now, how important the work of NCI is globally. So I'd like to turn it over to the Principal Deputy Director. Given NCI's leadership in cancer research and training, could you elaborate on the importance of partnerships to ensure that women in developing countries get access to quality in cervical cancer care?
Dr. Manrique, thank you so much for your question. Good morning, good afternoon, everyone. And I want to commend the Islamic Development Bank and IAEA for organizing this session. My take-home message really is that this is a global problem. It requires global solutions, but the solutions need to be tailored to the situation on the ground, and the situation on the ground is that that involves individual women. And many of these women are still quite young. Their children are still growing. And if these women are lost from society, the impact is not just on these women, but in addition on their children. And so there is a generational component which makes this issue that much more urgent. I would say that we want to have a comprehensive approach, but on the other hand, we do not want perfection to be the enemy of the good. In the context of today's meeting, radiotherapy is an important cornerstone of cancer treatment, as you have already heard, both for breast cancer as well as for cervical cancer. But there, in addition, are upstream opportunities for prevention, screening, and treatment before the development of cancer. And in addition, the importance of surgery and chemotherapy should not be missed. What this all requires is cooperation. And because of the problem, it requires that there be international cooperation. Whatever support is going to be provided needs to be leveraged, as many people have said, but an important way of leveraging it is by increasing efficiency, by incorporating the particular intervention that's being supported in the context of what is available on the ground. The opportunities are enormous, and we must not wait to try to develop them. And whatever individuals or funders are willing to work, what we should commit to doing is to work cooperatively with them so that their investment can be used efficiently and, as other people have said, sustainably. Thank you very much.
Thank you very much for your comments. And one of the things that, we've heard a lot from the public sector, and now really in terms of the private sector, in terms of the Swiss Federal Office of Energy, their role has been really critical in mobilizing a lot of the private sector. Mr. Ralph, the private sector plays an important role in helping to achieve and finance progress towards these ambitious global development goals. How can the initiative presented here today benefit from Switzerland's experience in mobilizing private sector partners and catalyzing investments for scaling up cancer services in the emerging markets?
Thank you very much, Joan, and good morning and good afternoon from Switzerland, from Bern, from our capital, to all the participants. It's really a pleasure for us to be here and to hear the very impressive messages what you have given so far. And really thank you. And it's for us, especially for me, we are interested to learn because this is always very, very interesting in a very dynamic field. Maybe let me describe our experience. Over the many years, Switzerland supported the IEA efforts to improve health with life-saving radiotherapy, making significant contributions to alleviating deaths and suffering from cancer worldwide. And especially 10 years ago, the IEA established the PACT, the Program of Action for Cancer Therapy, to improve cancer, what we all know. So, and we think this is also could be very fruitful or grown with partnerships from other UN organizations like WHO or the International Agency for Research in Cancer. We think when we go back to our experience, in the past, our Swiss governor worked together with the PAC division to enable or to facilitate meetings with private or with private donors in Switzerland. And I think this is maybe this is in Switzerland the best way to go forward to have this to create a platform where we can all to bring the people together and to discuss these things. For us, it's very clear. I think Switzerland could be has a lot of number of foundations, especially in the health sector. However, the competition for funds is also very great, and the contributions should be convincing. I think one last thing is that the development of cancer care service should also enjoy a high priority in the recipient country. This is very important for us. That we think that the priority should go beyond the Ministry of Health, for example, through the involvement of media or other charity functions. So I think there should be we think there should be a strong link between and should be also show their own efforts. When we look in total, we think this is a very, we are really willing to help you. We are learning, and what we can offer is to facilitate meetings together with the EIA, especially with the PAC division in Switzerland, to elaborate or to make public and private donors very attractive for this initiative. Thank you very much for your attention.
Thank you so much. And, as we've heard a lot from the different public sector partners, the implementers, but we really couldn't do this without the private sector. And last but not least, Varian has been a global leader to bring quality cancer care to women in the emerging markets, and really a champion of, pioneering new solutions. So Chris, I'd like to turn it over to you in terms of how a company like Varian, which looks at the whole ecosystem of addressing access to cancer care, work with both IAEA and ISCB. And what does private sector need to work with these groups? How can we all best work together to achieve the main goal of improving access to women's cancer care?
Well, thanks, Joanne, and thank you all to all of the esteemed guests, ambassadors, and government leaders who have already spoken about how we can work together to fight cancer. I'll address your question in two parts. First, I'll give a brief introduction of Varian, and then we'll talk a little bit about how we can work together. But just as a reflection point as I get into this, discussions like this are so inspiring. And thinking back to what Dr. Hayat said, and the real focus and the number of lives we can save, and the specificity and focus around how we're going to go after specific cancers and the impact of women, these are the types of initiatives that will move the needle. We need to be specific, we need to measure, we need to show the impact. And Varian as a company, our vision is a world without fear of cancer. I've had the incredible opportunity over the past 2 decades to travel around the world within the company construct to look at how can we make an impact in different parts of the globe. And this focus of creating a world without fear of cancer, we've been doing it as the world leader in radiation oncology. But over the past 3 years, we've been in a transformation that's been focused on bending the curve to access and quality of care. That's meant that we have needed to go beyond just being a solutions provider of equipment, but now we need to be a solutions provider of the types of services and the gaps that exist for trained personnel locally. And so to be slightly more specific around this, there's really 3 areas that we see being able to have a significant contribution in partnership. First is we built out a platform through CTSI, Cancer Treatment Services International. This is a services component of Varian, where what we do is supply clinical services like treatment planning, physics, quality assurance, many of the points that are required to ensure a high quality of care, but also in parallel, creating an opportunity to educate locally, to lift up societally what's happening in training, in education. This has been critical to bend that access curve. As one of our great partners, Icon Group, and their CEO says, where you live should not determine if you live. And this was really the pretense of our CTSI acquisition. Second, from CTSI, we built a platform named Halcyon designed for the exact applications we're discussing today. The system is self-shielded, it fits into a very small vault, it requires half of the electricity, and it has the opportunity to treat almost twice the number of patients as what you would see with conventional systems, and almost 3 times the number with historic cobalt type of solutions that really leaves so much limitation in what we can do. And then I'd be remiss not to reference what we've done with brachytherapy. As we talk about cervical cancer very specifically, the reality is brachytherapy is fundamental in being able to eradicate that disease. And in that regard, we built platforms that have got all sorts of safety capabilities, ease of use, et cetera. So we stand ready from a solutions perspective, really complete from services through products. But as we think forward into the second area of answer to your question, and we look at partnership opportunities, our view is that it needs to be a sustainable long-term partnership. And what I mean by that is it's not about supplying equipment, it's about providing training and education, it's about partnering with the groups that are here to create sustainability. And that first step, that first domino, will knock down so many more downstream. And as we look at how we as a company can specifically help here, we stand ready to help to educate how radiotherapy can have such a significant impact. We stand ready to forward deploy resources to ensure that we provide the training and education, and we stand ready to contribute to education and things outside of just the therapy, such as how do we create more awareness of innovations like the HPV vaccine, where if we could begin to get ahead of this in many of these countries, we could reduce the downstream burden of cervical cancer and other cancers. So with that, I want to thank you again for the opportunity to introduce Marian, and I personally and professionally look forward to continuing this conversation and increasing access to cancer care.
Thank you so much, Chris. Your comments are welcomed. I mean, as you just said, it's not only about the healthcare products, it's the whole ecosystem. It's the innovative solutions for the whole system in terms of what you're doing for bringing people, data, and technology together to the next generation and the services to fight cancer. So this is truly innovative. So thank you so much for your remarks. So I've just been giving a notice that we're a little bit over time. So Dr. Hayat, I'd like to turn it back over to you in terms of, finalizing some of our comments.
Thank you very much. As I said, it's so lovely to have you all and to hear you. I'm such an inspired by all your commitment and for you to be here with us and share your thoughts and also your valuable action. And also, I just want to carry on with the last point with Tony, when you mentioned about innovation. We want to invite you all for our session in the partnership with IAEA on the 22nd of September, when we're going to announce a really special 4 winners, because we wanted to involve SMEs, we want to involve entrepreneurship, we want to involve innovation. So what we did, we opened a call for innovation specifically for diagnostic and low-cost diagnostic and capacity building for cervical and breast cancer. And we received an amazing proposals from many different countries, more than 81 countries, and we selected the top 4 who are really put their effort and thought and time and commitment to really to encourage the local innovation and the local entrepreneurs. So we're going to announce the winners as ISDB would be funded more and give them seed money for their own project. So I really appreciate that with so many points. We talked about awareness, we talked about NGO, we talked about education, we talked about feasibility and sustainability, we talked about private sector and non-governmental organization, and also non-traditional way to be creative and innovative, how we can source mobilize. We all need to be together to give help. Losing somebody so close, it's not an easy thing. And imagine you losing somebody and it costs $10 to save their lives. So it's devastating. So hopefully that we all can help and give a future for young women and also for mothers to be with their family and to strengthen the community. I do appreciate all your help, and I hope that we can have further discussion with you to be with us in this partnership. Thank you very much for you, to all of you to be here, and I'm really, really appreciate it. And also I want to thank our partners with the great help, and the whole team, and His Excellency and DJ for their own support and unconditional help whenever what we need from them. And we need leaders like this, and also a team with dedication, and they never gave up and they never get tired seeking to how to help the women around the world. Thank you.
Thank you so much, Dr. Hayat, and again, thank you for your leadership. Dr. Lisa, I'll turn it over to you for closing remarks.
Thank you so much, Joanne, and I would like to echo the comments of Dr. Hayat that this was a really great webinar today to hear what others are doing, and the comments about integrating and increasing efficiency and looking at the sustainability, that really did resonate with me. To build on what Dr. Hayat said, we are pleased to announce there will be a side event during our general conference. It's actually going to be Thursday, September 24th, and we'll be very pleased to share more information, but we'll have the pleasure of hosting His Excellency as well as Dr. Hayat here for our general conference and for this side event. We'll talk more about the progress that we've made over the last year, and we'll hear some specific stories from member states and how they plan to engage with this initiative. And again, to Dr. Lowy's point, what's going to happen on the ground as a result of these partnerships, these donors, and this initiative. We'll hear about the Call for Innovation winners, and hopefully more about the 5P mechanism, the trust fund, that will be available for supporting these projects. So we look forward to ongoing engagement, and since it will be a virtual event, we welcome you to invite your friends, your colleagues to listen in and really hear about this progress. So again, thank you to all for the interventions and the comments, and we look forward to moving into the future.
Thank you so much, Lisa, and thanks so much, Dr. Hayat as well. In terms of the value of the partnerships, we've discussed engaging both with the private sector and public sector. So we look to the follow-up. We'll be following up with each of the partners and working as we move towards the Pledge Conference. So thanks again to all the participants of the conference today, and we look forward to next steps.